In this video, we'll be discussing Toric IOL in small pupil, a unique method to ensure accurate intraoperative alignment. A well-dilated pupil at the end of the surgery really helps in Toric IOL alignment, but when the iris covers these marks, it's always a difficult process to make sure that IOL is aligned according to the axis. Well-dilated pupil gives good visualization, which is useful for achieving accurate final alignment, because even after hydration of the incision or OVD removal, you must be sure that IOL is aligned perfectly. 10-degree misalignment means 33% loss of effect of the toric IOL. But it is not always possible in all cases. If the pupil constricts or is smaller throughout the procedure, when you place the IOL in the bag, there is always a struggle to visualize those marks on these toric IOLs, and you may have to retract the iris to check for the mark or move the eye side to side so that the marks under the iris can be seen, or you can inflate the AC to dilate the pupil momentarily or use dilating medication and drag the IOL to check the marks. But despite all the efforts, at the end of the surgery, you are a little bit unsure whether it is exactly aligned or not, particularly when the pupil is really small, like in this case. So when the pupil is smaller, it becomes even more difficult. You have to nudge the IOL around, you have to nudge the iris, and you can always watch only one mark at a time. So there might be an error in alignment. Then why not use pupil expansion devices? Definitely with pupil expanders, the surgery becomes easy. The method that I follow is that inject the IOL under OVD, align it properly with OVD removal, and then again reform the anterior chamber with 1% hyaluronate, which is a cohesive agent, and then remove the pupil expansion devices, because you need OVD in the anterior chamber while removing these devices, otherwise it may damage the endothelium. And then we remove the hyaluronate finally without disturbing the IOL alignment. Still, as small pupil reduces the visualization of the axis, you are still unsure whether the IOL is properly aligned or not. There is a innovative method by Dr. Sri Ganesh. Using this marker, we make indentation on the center of the optic. The indentation disappears quickly and it's not possible with hydrophilic IOLs. So you have to be really quick in IOL injection and then alignment. We describe a novel method, which is a very simple method using this 30 gauge needle. Just touch the optic central to the mark with 30 gauge needle, 3.5 to 4 millimeter apart. It is a very tiny mark and can be used with hydrophobic or hydrophilic material, and it will not cause any abrasion. Just to show it again, it's just gentle touch on the IOL surface and no pressure is given on the IOL. So you can see those marks. These are very tiny marks, visualized only under high magnification. IOL is loaded normally and then we follow the usual steps. Now there is no worry of pupil getting smaller after OVD removal or after removal of the pupil expansion devices. And even we can check the post-operative alignment, because these marks are visible though very barely post-operatively. So this is how we align intraoperatively. You can see those very tiny marks there are useful for the final perfect alignment along the axis. You can see those marks here, they are little bit misaligned, so we can nudge the IOL so that they come to the final position of alignment, and now you can see those very tiny marks there which are aligned perfectly. And we don't have to look for these toric IOL marks under the iris and struggle with that. Even with smaller pupil, you can easily visualize these tiny marks. Post-operatively, if you see this patient, these are barely visible marks, so unless you use high magnification, and causes no aberrations at all. But if you want to check the IOL axis post-operatively, you can magnify and look for those marks and check the exact alignment. So this simple method requiring no special equipment takes care of all the problems we find with small pupil and toric IOL alignment. Thank you.